Hi, I'm David Pope. Welcome to Clinical Edge's free presentation this week of low dye taping with Russell Wright.
Hi, I'm Russell Wright from Central Coast Foot and Ankle Physiotherapy. Today we're going to look at low dye taping. Low dye taping is often used for conditions such as plantar fasciosis, tibialis posterior tendinopathy, and other conditions where you want to limit or slow down the rate of pronation, such as patellofemoral pain or maybe medial tibial stress syndrome. First, we're going to prep the skin with the razor. Okay, first we're going to put some under tape on from the first ray to the fifth ray. Smooth that down. Over the dorsum of the foot. And under the plantar surface, first ray to fifth ray. Okay, for this taping I'm using 25mm tape. I find it easier to work with around the heel. So we start from the first MTPJ just behind it so you don't limit the extension at that joint. Come around the heel to the fifth MPTJ, just behind that. And then again, first MTPJ to fifth MPTJ. Then we go from the same starting point around the heel and back towards the first MTPJ, the plantar surface. Taping just keeps on going round from the first MPTJ and fanning across the foot. That one's to the second, towards the second toe, and then towards the third toe. You might need 4 of these, you might need 5. 4 is usually enough. Across towards the fourth and fifth toes. And then you want to just lock that off. So the same as where we started, first MPTJ towards the fifth. And then we just need the patient to stand up to finish that off. This taping needs to be done in standing because the foot gets wider when you stand on it with your body weight over it. So that just gets taped off to keep the tapes secure on either end, and so that it's not too tight that it constricts blood flow to the toe. So there are many different ways of doing low dye taping, and the reason why I like this one, particularly for plantar fasciosis, is because the plantar fascia insertion is left out of the tape, so you don't have any tension points from that plantar fascia, and this is relatively easy enough to teach the patient to do themselves if it's a condition that needs it done often. Okay, so when you've finished your taping, make sure you always give the your taping warnings to your patient. So tape should always be comfortable. It's there to make you more comfortable. If it's not, then take the tape off. If your skin gets itchy or you see some redness around the tape, then make sure you take that off straight away. If your toes go tingly, blue or numb, then definitely get the tape off so that you don't lose the blood flow to your toes and they fall off.